Hello, I'm Dr. Kapiljit Chakravarty. I'm consultant nephrologist and renal transplant physician. I'm also head of the Department of Nephrology in Bankura Shamanani Medical College Hospital. Today's session we'll be discussing regarding edema. So we'll be discussing regarding the causes, the symptoms, and finally we'll discuss regarding the treatment of edema. So before knowing about it, first let us see what actually is edema. Edema is actually an abnormal accumulation of fluid in any part of your body, be it a localized accumulation or could be a generalized accumulation. When it is localized to a part such as lower limbs or upper limbs, there is local swelling because of accumulation of fluid in the interstitial space. Whereas in very serious conditions, you can have accumulation of fluids in your whole body. The whole body interstitial spaces actually gets swelled up by fluid and resulting swelling of the whole body. Now, what are the causes of edema? Now, if you see common causes of edema, so I think you have commonly noticed that when you sit for prolonged duration, you have swelling of your lower limbs. This is quite a natural phenomena. The cause behind is that the blood that gets pulled up in lower limbs are actually pumped by the muscles. Now, whenever you are sitting idle, you are not moving your limbs, muscles are not working. So there is no pumping of blood, which is actually accumulating in your lower limbs. As a result, the blood gets pulled up in the lower limb, resulting in accumulation of fluid in the interstitial space and finally swelling of the limb. So this is a common phenomena and occurs commonly in people, and this is not a disease condition. Apart from this, there are many diseases which actually cause swelling of lower limbs or upper limbs or the whole body. So the common causes include you have ailments of heart, kidney, etc. So if you have a heart failure, you have a poor functioning heart which is not able to pump blood. As a result, the blood gets pulled out in dependent portions of your body, resulting in swelling of the lower limbs. Also, in patients who are having kidney ailment, they are not able to excrete enough of fluid, and fluid gets accumulated, as resulting in swelling of the lower limbs. Also, in kidney ailment patients, you have loss of protein, resulting in a lot of accumulation of fluid in interstitial spaces and swelling of whole body. Apart from that, there could be local causes like an infection. If you have an infection in any part of your body, which can result in swelling and edema. Other important causes are if you have clotting of blood in any of your veins in the lower limbs, which can result in localized swelling and pain. Apart from that, some chronic conditions such as lymphatic filariasis, where the lymphatics are blocked by an infection by a worm filaria, and you can have swelling of limbs. And often the swelling is so huge that the limb resembles the limb of an elephant. This condition is also known as elephantiasis, and it's because of lymphatic filariasis. Now, whenever you notice that there is swelling of any of your limbs, it's important that you consult your physician, your doctor, and try to evaluate the cause for it. Because at times, it could be an indication of a serious ailment that you are suffering from. So, as soon as you notice edema, do not neglect it. Immediately rush your doctor, discuss with him regarding it, and let him investigate. So, once on investigation, definitely we'll try to evaluate and find out the cause for edema and treat accordingly. Often, edema is actually because of accumulation of blood. Mostly, if you have symmetrical edema, means you have edema of both the lower limbs, or you have swelling of the whole body. So, in those cases, you have accumulation of fluid, and this excess fluid which is accumulating needs to be removed from the body. And in this aspect, diuretics are the drugs. Diuretics are the drugs which remove excess water from your body. So this group of drugs can be utilized to get rid of excess fluid that is accumulating. Apart from some advices like salt restriction, daily fluid restriction. Among the diuretics, you have commonly used torsemide and furosemide, which are being commonly used. Furosemide has been used for long, and torsemide has come up recently and has been doing wonders. Actually, there are a lot of advantages of using torsemide over furosemide, and I'm not going to details because it's outside the scope of discussion in this session. So what is very important is that do not neglect any swelling of your limbs. Immediately rush to your doctor, investigate the cause, find out the cause, and try to treat the cause. This will help in managing edema in long term. Thank you.